Hello, my name's John. I'm a contact lens optician and anterior eye specialist at Jackson & Co. Thank you to The Body Doctor for sponsoring this information video for patients. Today we're going to be talking a little bit about dry eye disease. So what is dry eye disease? Well, dry eye disease is a multifactorial condition. That means that there are lots of things that can cause it. So it could be age, general health, medication, environmental, even occupational. And it results in a loss of balance in the tear film. That's the little bit of liquid that sits on the front of the eye. When that can't keep itself balanced, our eyes will feel uncomfortable, gritty, sore, itchy, they may water more than usual, and if going unchecked, it can even affect our quality of vision. So you may have heard the term blepharitis. This is often associated to dry eye and is a precursor to dry eye disease. The literal translation for blepharitis is inflammation of the eyelids, and it usually affects the eyelid margins. Now, you won't always have symptoms, but you might notice that the edges of your lids sometimes look more pink, your eyes might feel a bit gritty or itchy, and it'll usually feel worse in the mornings or sometimes at the end of the day. As a clinician, what we'll be looking at is debris in the lashes, usually an increased redness around the edges of the eyelids, and we'll even see that some of the glands in the eyelids don't perhaps express fluid as easily as they should. And when that's happening, that's called meibomian gland dysfunction. So when our glands in our eyelids don't express fluid as easily as they should, it reduces the quality of our tear film. What that really means for us is that it can even affect the quality of our vision, since the tear film is the first bit that light hits when it's coming into our eye. So that needs to be smooth and stable for a clear image, and if it isn't, then we don't see very well. It can also affect physical comfort, since the lubricating layer of the tear film is reduced and things won't be as nice. Lastly, our tear film carries antibodies, so if this is reduced, it can even increase our risk of infection.